this is one of newer tests that we have in terms of risk stratifying heart disease. Calcium score is being done increasingly in many patients as part of their routine medical screening. But what exactly is it? What information does it give us? Well, to understand it, we have to understand that when we talk about the calcium score, we are actually measuring the amount of calcium that's deposited in the heart arteries. When we talk about the blockages in the heart arteries, what we're referring to is the deposit of atherosclerotic plaques. Now, these plaques that build up in the arteries are what causes the blockages in coronary arteries. And these plaques are made up of a variety of material, including cholesterol, fats, and calcium. Now, plaques, when they get deposited in the arteries, are often soft plaques to begin with. But over time, these plaques do harden, they become calcified as the calcium load builds up. So the calcium score is a measure of all that calcification because the calcium is visibly seen on X-ray scans. It's actually, in a way, a measure of the plaque burden because indirectly, by measuring the amount of calcium that's deposited in the heart arteries, we have an idea as to how severe the extent of the atherosclerosis process has affected the heart. So a higher calcium score means you have more atherosclerotic plaques, means you have the higher amount of blockages seen in the coronary arteries. So in that sense, it's a useful risk stratification tool to tell us that obviously if the calcium score is high, you're at higher risk of having heart attacks or heart blockages because you have more calcium deposits in the heart arteries. Actually, a non-invasive test. It's done using a computed tomography or basically a CT scan technology. The patient lies down, enters a CT scan, they have to lie still. Ideally, when you do a cardiac CT scan, you would need to have a slow resting heart rate, and the CT scan then rotates around your heart, and a 3D image is taken, and from that, we can actually calculate the calcium score. So it's a very simple test, may be done in 5 to 10 minutes. Is it a test without risk? It is simple, it's non-invasive, but there is obviously more exposure to some radiation. But the radiation dose involved is low, unlike a full cardiac CT angiogram, where in addition to doing a calcium score, a contrast is injected and a full 3D scan is done looking at heart arteries. That gives us more information, obviously. But the CT angiogram, which is different from the calcium score, involves injection of dye and a slightly longer procedure as to take a 3D image of the heart. To give you an idea of what the calcium score means, obviously if you're a young patient, you go for a calcium score and the calcium score is 0, that means your coronary arteries are clear, do not have any calcified plaques seen. People with normal coronary arteries quite often have a score of 0. 0 up to 100, so a calcium score up to 100 is considered what we call a low calcium score. So anything up to 100 may indicate the presence of mild atherosclerotic plaques, mild calcification seen, which means your risk of heart attacks is considered low. You're in the low risk category. Well, if you look at guidelines, the calcium score is most useful for patients who are already in intermediate risk. Tests will give us complementary information as to whether these patients who are in intermediate risk require further evaluation. If your score is high, then there may be an indication to proceed with coronary angiography. Whereas if the score is low, then you may decide to treat the patient conservatively. So it is a very useful test and gives us additional or incremental information regarding the patient's risk profile, particularly in the intermediate risk group. On the other hand, if you are already in a high risk category, then the calcium score may not be too useful. Because in those patients, in any case, if you're already in a high risk group, you would be proceeding with a more accurate test or heart scans, for example, the full CT angiogram or a coronary angiogram. Well, thank you for watching. I hope you liked the video. If you do, please don't forget to like, share, and comment. Thank you.